So we quickly want to look at another branch of pharmacology, so to say, and this is what is known as the geriatric pharmacology. All right. So anytime you hear geriatric, you are simply dealing with old people. Anytime you hear geriatric, you are dealing with old people. So it's also called what geropharmacology. So it's a study of how medicines affect older adults. So you are focusing on, you want to give somebody the age, but you are trying to actually you want to give somebody a drug, but you are putting the age into consideration. Okay, so you are trying to look at how age is affecting drug absorption, distribution of drug, and metabolism of drug. So key features of geriatric pharmacology is you are looking at how the body is changing with age. Okay, so you are looking at absorption, which is generally unchanged, but could be affected because there's slow movement of the stomach. Peristalsis is now occurring slower in old age. Distribution, you are now looking at the person has more fat now, so there's prolonged half-life of some drugs. Metabolism, you are looking at how the liver have been affected all this while, and blood flow is also sluggish. Okay, so there's slower breakdown of drugs. Then excretion, you are trying to look at the kidneys and how the functions of the kidney is actually going down with age. Okay, so impaired renal clearance of drugs. So polypharmacy, you are trying to also consider that, okay, if I'm going to combine many drugs to be used for a particular patient, you understand, I should be putting all those constitution of drug reactions, and all of that. So you also look at the aspect of adverse drug reactions. So adults are most likely to have all these adverse drug reactions. So symptoms may also mimic old age. So you also look at all those high-risk drugs like the anticoagulants, opioid. You look at some particular drugs that are likely to cause more issues to the person than others. So when you're giving it, you always consider and give the drug that is actually user-friendly for the individual.